Welcome back to our channel. In this video, we'll be discussing one of the most important vitamins for our overall health, vitamin D. While most of us associate vitamin D with sunlight, there's much more to this vitamin than just that. Today, we'll be diving deep into the history, benefits, and recommended doses of vitamin D. Please stick to the end of the video where we will give you information on how much vitamin D3 to take and tell you about another vitamin that is essential to take if you decide to supplement vitamin D. So let's start with the basics. Vitamin D is a fat-soluble vitamin that plays a crucial role in the body's absorption and utilization of calcium and phosphorus. It also helps in regulating cell growth and reducing inflammation. While most of us associate vitamin D with sunlight, there's much more to this vitamin than just that. The history of vitamin D goes back to the early 20th century, when scientists discovered its importance in preventing rickets, a bone disease caused by a lack of vitamin D. In the early 1900s, rickets was a widespread disease in the industrialized world, affecting millions of children. The disease was characterized by weakened bones, skeletal deformities, and stunted growth. At the time, the cause of rickets was unknown, but it was suspected to be related to diet or exposure to certain environmental toxins. In 1922, a British doctor named Edward Mellanby conducted an experiment that changed the course of rickets research. He fed a group of dogs a diet lacking in vitamin D and found that they developed rickets. However, when he added cod liver oil to their diet, which is high in vitamin D, the dogs' bones started to heal. This experiment proved that rickets was caused by a deficiency of vitamin D and that vitamin D could be used to treat the disease. Following this discovery, researchers started to investigate the role of vitamin D in other health conditions. In the 1930s, it was discovered that vitamin D could also be synthesized by the body through exposure to sunlight. This led to a renewed interest in vitamin D research, and over the years, scientists have uncovered a multitude of health benefits associated with vitamin D. Research has shown that vitamin D plays a crucial role in bone health, immunity, and overall well-being. It helps in the absorption of calcium and phosphorus, which are essential for bone growth and maintenance. It also helps in activating the immune response, which helps in fighting infections and diseases. Additionally, studies have shown that people with higher vitamin D levels have a lower risk of chronic diseases such as cancer, diabetes, and heart disease. While sunlight is a natural source of vitamin D, it's not always possible to get enough of it, especially during the winter months. That's why many people take vitamin D supplements or consume foods that are high in vitamin D, such as fatty fish, egg yolks, and fortified dairy products. The discovery of vitamin D and its role in preventing rickets was a major breakthrough in the field of nutrition and medicine. Since then, research has shown that vitamin D is not only important for bone health, but it also helps in regulating cell growth and reducing inflammation. With the rising prevalence of vitamin D deficiency, it's important to ensure that we're getting enough of this essential vitamin in our diets or through supplements. So let's crack on with our top 5 health benefits of taking vitamin D3 daily. Number 5. Reduced risk of type 2 diabetes. Type 2 diabetes is a chronic condition that affects millions of people worldwide. It occurs when the body is unable to use insulin effectively, resulting in high blood sugar levels. Maintaining good vitamin D levels may help reduce the risk of developing type 2 diabetes. Several studies have found an association between low vitamin D levels and an increased risk of type 2 diabetes. For example, a systematic review and meta-analysis published in the journal Maturitas analyzed 22 observational studies, and found that individuals with the lowest vitamin D levels had a 52% higher risk of developing type 2 diabetes, compared to those with the highest levels. Another study published in the Journal of Clinical Endocrinology and Metabolism found that vitamin D supplementation improved insulin sensitivity and glucose metabolism in individuals with prediabetes. In this study, participants who received vitamin D supplementation for 6 months had a 12.8% improvement in insulin sensitivity, compared to those who received a placebo. The exact mechanisms by which vitamin D may reduce the risk of type 2 diabetes are not yet fully understood, but it's thought that vitamin D may play a role in insulin secretion and glucose metabolism. In conclusion, maintaining good vitamin D levels may reduce the risk of developing type 2 diabetes. While more research is needed to determine the optimal vitamin D levels and the best methods for achieving and maintaining those levels, these findings suggest that vitamin D supplementation may be an important component of diabetes prevention and management. Number 4. In addition to type 2 diabetes, vitamin D may also play a role in regulating mood. Several studies have found an association between low vitamin D levels and an increased risk of depression and other mood disorders. It's thought that vitamin D may play a role in regulating neurotransmitters in the brain, including dopamine and serotonin, which are involved in mood regulation. A study published in the Journal of Internal Medicine found that vitamin D supplementation improved symptoms of depression in participants with low vitamin D levels. Interestingly, a little-known fact about vitamin D is that it may also be beneficial for seasonal affective disorder, SAD, a type of depression that occurs during the winter months when sunlight exposure is limited. A study published in the Journal of Nutrition found that vitamin D supplementation was effective in reducing symptoms of SAD in participants with low vitamin D levels. In conclusion, taking vitamin D daily may play a role in regulating mood and reducing symptoms of depression and other mood disorders. So if you are feeling down or depressed and you are not supplementing vitamin D, try taking some, as it may alleviate your symptoms. Number 3. In addition to type 2 diabetes and mood regulation, research has suggested that taking vitamin D may help reduce the risk of chronic diseases. Several studies have found an association between low vitamin D levels and an increased risk of conditions such as heart disease, diabetes, and certain types of cancer. In fact, a study published in the Archives of Internal Medicine analyzed data from over 3,000 adults and found that those with low vitamin D levels were twice as likely to die from heart disease and other causes compared to those with higher levels. While the exact mechanisms behind these associations are still being studied, it's thought that vitamin D may play a role in regulating inflammation and immune function, as well as influencing cellular growth and differentiation. Interestingly, a study published in the Journal of the National Cancer Institute found that higher vitamin D levels were associated with a reduced risk of colorectal cancer. The study analyzed data from over 5,000 adults and found that those with the highest vitamin D levels had a 50% lower risk of developing colorectal cancer compared to those with the lowest levels. It's worth noting that while these studies suggest an association between vitamin D and reduced risk of chronic diseases, they do not prove causation. Further research is needed to determine the optimal vitamin D levels for reducing the risk of these conditions, and the best methods for achieving and maintaining those levels. In conclusion, taking vitamin D daily may help reduce the risk of chronic diseases, including heart disease, diabetes, and certain types of cancer. Number 2. Bone health. One of the most well-known benefits of vitamin D is its role in promoting bone health. Vitamin D helps the body absorb calcium and phosphorus, two minerals that are essential for building and maintaining strong bones. With a lack of good vitamin D levels, the body can't properly absorb calcium, which can lead to weakened bones and an increased risk of fractures. Research has shown that vitamin D supplementation can help prevent bone loss and reduce the risk of fractures in older adults. In a study published in the New England Journal of Medicine, researchers found that a daily intake of 800 IU of vitamin D3 reduced the risk of hip fractures in postmenopausal women by 30%. Interestingly, a little-known fact about vitamin D and bone health is that it may also play a role in muscle function. Research has suggested that vitamin D deficiency may be linked to muscle weakness, and that supplementation with vitamin D may help improve muscle strength and balance in older adults. In fact, a study published in the Journal of the American Geriatrics Society found that vitamin D supplementation improved muscle strength and reduced the risk of falls in older adults. The study analyzed data from 30 randomized controlled trials and found that vitamin D supplementation reduced the risk of falls by 22% in older adults. It's worth noting that while vitamin D is important for bone health, it's not the only factor to consider. Other nutrients, such as calcium and magnesium, as well as weight-bearing exercise, are also important for building and maintaining strong bones. In conclusion, taking vitamin D daily can play a crucial role in promoting bone health and reducing the risk of fractures, especially in older adults. Additionally, vitamin D may also play a role in improving muscle function and reducing the risk of falls. It's important to ensure that we're getting enough vitamin D through sunlight exposure, diet, or supplements, along with other bone-supporting nutrients and exercise, to maintain strong and healthy bones. Number 1. Boosting immunity and preventing SARS-CoV-2 and seasonal flu. Vitamin D is a fat-soluble vitamin that plays a crucial role in supporting the immune system. Research has shown that vitamin D can enhance the function of immune cells, such as T cells and B cells, which play a crucial role in fighting infections. A number of studies have suggested that vitamin D supplementation may have a protective effect against respiratory infections, including COVID-19. One study, published in JAMA Network Open, found that individuals with sufficient vitamin D levels had a significantly lower risk of testing positive for SARS-CoV-2, the virus that causes COVID-19. The study analyzed data from nearly 200,000 patients and found that those who were vitamin D deficient had a 1.77-fold higher risk of testing positive for COVID-19 compared to those who had sufficient vitamin D levels. Another study, published in the Journal of Clinical Endocrinology and Metabolism, found that vitamin D supplementation may reduce the risk of developing acute respiratory distress syndrome, ARDS, in COVID-19 patients. ARDS is a severe lung condition that can occur in some patients with COVID-19 and is associated with a higher risk of mortality. The study analyzed data from 489 COVID-19 patients and found that those who received vitamin D supplementation had a significantly lower risk of developing ARDS compared to those who did not receive vitamin D supplementation. Additionally, a study published in the Journal of Steroid Biochemistry and Molecular Biology found that vitamin D supplementation was associated with a lower risk of ICU admission and mortality in COVID-19 patients. The study analyzed data from 7 randomized controlled trials and found that vitamin D supplementation was associated with a 52% lower risk of ICU admission and a 68% lower risk of mortality in COVID-19 patients. In conclusion, taking vitamin D daily can play a crucial role in supporting the immune system and may have potential benefits in protecting against respiratory infections, including COVID-19. Studies have suggested that vitamin D supplementation may reduce the risk of hospitalization, ICU admission, and mortality in COVID-19 patients. It's important to ensure that we're getting enough vitamin D through sunlight exposure, diet, or supplements to maintain a healthy immune system. So as promised, here is some information on how much vitamin D3 to take and another vitamin you should definitely consider taking if you intend to supplement vitamin D. If you are taking vitamin D, it is also important to take vitamin K2 alongside. Vitamin D3 and vitamin K2 are both important nutrients that play distinct roles in the body. Vitamin D3 helps regulate calcium absorption and bone metabolism, while vitamin K2 helps regulate calcium distribution and helps direct it to the bones where it's needed. When vitamin D3 increases calcium absorption, it can also increase calcium deposition in the soft tissues of the body, such as arteries and joints. This can lead to calcification, which can be harmful. Vitamin K2 helps prevent this by activating proteins that help transport calcium out of the soft tissues and into the bones, where it's needed. Taking vitamin D3 and vitamin K2 together can help ensure that calcium is properly absorbed, utilized, and directed to the bones, reducing the risk of calcification in the soft tissues. Vitamin D is primarily obtained through sun exposure, and people living in countries with less sunlight may not be getting enough of this essential nutrient. As a result, they may need to supplement with higher doses of vitamin D3 to achieve adequate levels. The recommended daily intake of vitamin D varies by age and other factors, but generally ranges from 600 to 800 IU per day for most adults. However, studies have shown that people living in countries with less sunlight may need higher doses, with some experts recommending up to 2,000 to 4,000 IU per day. As a side note, we take around 4,000 IU a day of vitamin D3 that also has vitamin K2 included, so we don't need to buy extra tablets, which are more convenient and can be easily purchased online. Also, please bear in mind that the time it takes to experience the benefits of supplementing with vitamin D3 can vary depending on factors such as age, health status, and the dosage of the supplement. However, in general, it typically takes several weeks to several months for vitamin D levels to increase in the body and for the effects of supplementation to be noticeable. According to the Institute of Medicine, it can take approximately 8 to 12 weeks of consistent daily vitamin D supplementation for an individual's blood levels of vitamin D to reach optimal levels. However, some people may start to feel the effects of vitamin D supplementation, such as improved mood, increased energy, and stronger bones, within a few weeks. It's important to note that the effects of vitamin D supplementation can also depend on an individual's baseline levels of vitamin D, with those who have lower initial levels likely to see more significant improvements in their health with supplementation. It's essential to note that while vitamin D supplementation is generally safe, it's still possible to overdose on this vitamin, which can lead to adverse effects such as hyperkalemia. Hyperkalemia is a medical condition in which there is too much potassium in the blood. Therefore, it's advised to work with a healthcare provider to determine the appropriate dose of vitamin D for your individual needs, and to monitor your blood levels regularly. In conclusion, taking vitamin D3 alongside vitamin K2 can help ensure that calcium is properly absorbed and directed to the bones, reducing the risk of calcification in the soft tissues. People living in countries with less sunlight may need higher doses of vitamin D3 to achieve adequate levels, but it's advised to work with a healthcare provider to determine the appropriate dose and to monitor blood levels regularly. So there you have it, the top 5 benefits of taking vitamin D daily. From boosting immunity to improving bone health and reducing the risk of chronic diseases, vitamin D plays a crucial role in our overall well-being. So, make sure you're getting enough vitamin D in your diet or through supplements, and don't forget to take it with vitamin K2 for maximum benefits. Thanks for watching, and remember to like and smash that subscribe button. We'll see you in the next video. Have a sunny week.